Landmark points for cranial approaches. Introduction. The purpose of this presentation is to show the landmark points for cranial approaches. These points are defined on base of the craniotopography, the relationship of the external landmarks of the cranium and the cerebral surface. Landmark points for cranial approaches. The craniometric points are landmarks over the surface of the skull. In relation to them, we can establish landmark points for the cranial approaches. The landmark points are cranial projections of cortical points over the head. Craniometric points. Here we can see the most important craniometric points. The following craniometric points are over the mid-sagittal line: the nasion at the frontonasal angle, the bregma 13 cm distal to the nasion, the lambda 12 cm posterior to the bregma and 7 cm above the inion. The inion is located at the external occipital protuberance. At the lateral surface of the skull, there are the following craniometric points: the pterion, the asterion, the superior squamous point, the upper projection of the squamous suture. The stephanion is the point at which the coronal suture meets the superior temporal line. The urion, or the most prominent point of the parietal bone. There are 2 points at the lateral surface of the skull that have no name: the confluence of the frontal, zygomatic and sphenoid bones, which is related to the limits between the anterior cranial base and the orbit; the confluence of the parietomastoid and squamous sutures, which is related to the petrous pyramid and is the most posterior point of the temporal skull base. Nasion. The nasion has relationships with the frontal sinus, sagittal sinus, and the interhemispheric fissure. A burr hole placed above this point at the glabella is used on the fronto-basal or fronto-orbital craniotomy. Sphenoidal, frontotemporal point and stephanion. The sphenoidal point is located below the pterion, at a depression on the greater wing of the sphenoid bone. A burr hole placed over this point exposes the anterior fossa and the middle fossa. Here we see the lesser wing of sphenoid bone separating the 2 fossa. It is over the sylvian fissure and the lesser wing of the sphenoid bone. The stephanion is located at the junction of the coronal suture and superior temporal line. The sphenoidal point and stephanion are the references for the pterional craniotomy. Fronto-orbital point and fronto-orbital craniotomy. The confluence of the frontal, sphenoid and zygomatic bones is the site of the fronto-orbital point. A burr hole at that location exposes the orbit and the anterior fossa, and it's the keyhole for the fronto-orbital craniotomy. Point for catheter placement at the frontal horn of the ventricle. The entry site point for the frontal horn is located 3 cm lateral to the bregma. Here we can see the placement of the catheter in the frontal horn. lateral and central sulci, and the SPO-IPO line. To identify the limits of the cerebral lobes, it is necessary to find, on the lateral surface of the hemisphere, the lateral sulcus, the central sulcus, and the line that connects the parieto-occipital sulcus to the pre-occipital notch. Lateral and central sulci. The line of the central sulcus is defined by the superior and inferior Rolandic points. The superior Rolandic point is located 5 cm posterior to the bregma. The inferior Rolandic point is located at the superior aspect of a line 7 cm vertical to the tragus. This point is the place of the superior squamosal point. The lateral sulcus or sylvian fissure is related to a 7 cm line which starts at the external canthus of the eye and passes through the inferior Rolandic point, close to the superior squamosous point. As we can see, the lateral sulcus and central sulcus meet at the superior squamosous point. Central and lateral sulci over the skull. Here we see over the skull the 3 lines used to identify the limits of the cerebral lobes. The central sulcus corresponds to the line that connects the inferior and superior Rolandic points. The lateral sulcus or sylvian fissure corresponds to the line passing through the canthus and inferior Rolandic point at the superior squamosous point. The line that connects the parieto-occipital sulcus to the pre-occipital notch is related to the line connecting the lambda to the asterion. With these 3 lines, we can delineate the cerebral lobes over the surface of the head: frontal, parietal, temporal and occipital. Frontal craniotomy. The frontal craniotomy is performed connecting 4 referential points. The anterior points, the nasum and the sphenoidal point, define the superciliary border of the brain. The posterior points, superior and inferior Rolandic points, define the central sulcus. The coronal suture in the middle of this craniotomy may be used to define a frontal craniotomy more anterior or more posterior. Basal temporal points and the anterior temporal craniotomy. To project the temporal lobe over the skull, we use 4 points. The anterior temporobasal point is located at the posterior border of the sphenoid bone. The posterior temporobasal point is located at the meeting of the parietomastoid and squamous sutures. It is the limit between the posterior and middle fossa. The sphenoidal and superior squamosal points are located at the level of the sylvian fissure. The connection of these 4 points define the anterior temporal craniotomy. Parieto-occipital sulcus and parietal occipital point. The parieto-occipital sulcus is located in both lateral and medial surfaces of the brain. The parietal occipital sulcus is located 5 mm in front of the lambda. It corresponds to the parieto-occipital point, which separates the parietal and occipital lobes. Parietal craniotomy. With 4 referential points, we define the limits of the parietal craniotomy. The anterior limit is the central sulcus, which is found connecting the superior and inferior Rolandic points. Its posterior limit is the upper half of the line connecting the lambda to the asterion. At the center of the parietal lobe is the urion. It has relationships with the supramarginal gyrus. Occipital craniotomy. The inion, the parieto-occipital point, and the asterion form the triangle which contains the superior occipital bone and the occipital lobe. The inion is over the occipital pole. The POP is over the POS, and the asterion is over the preoccipital notch. The occipital craniotomy is performed connecting these points. Point for the puncture of the occipital horn. The entry site point for the occipital horn is located 3 centimeters lateral to lambda. Here we can see the entry site point for occipital ventricular catheter placement. Posterior fossa. Each half of the posterior fossa is a rectangle formed by 4 points: inion, opistion, asterion, and digastric point. It covers the posterior surface of the cerebellum. The inion is the landmark point used to perform the median suboccipital craniotomy. Retrosigmoid craniotomy. The asterion is the reference to the superior sigmoid craniotomy. The digastric point is the reference to perform the inferior retrosigmoid craniotomy. Thank you for your attention.